Yeah, so I'm going to talk about the instruments in orthopedics commonly used. So first, I should start with the basic instruments which are used in surgery as well, and then I should go to orthopedic specific instruments. So this is commonly asked in your table Viva, and you have to score maximum in this because this is very easy to score. Most of the times you will be asked to identify the instruments, and also you will be asked to describe a use of it, or maybe some specific unique feature about the instrument. So let's begin about the instruments in orthopedics. Now the basic surgical instruments are the ones that you use in all surgeries, like forceps, scissors, retractors, periosteal elevators, rongeurs, nerve hooks, curettes, dissectors, and probes. Let's begin with the forceps. Now, all of you know that the artery forceps is one of the most important thing. Is called as a hemostat. It is used to clamp uh, blood vessels during bleeding, and it also has these two holes to hold it. So whenever you hold an artery forceps, you're supposed to put your thumb in one hole and your ring finger in the other. So these are the parts of the artery forceps. It can have blades, it can have a joint, and this has a ratchet. Ratchet is sort of a self-locking mechanism, and these are the bows, the shaft and the finger bows. Okay, so the cheatal forceps is something different. Cheatal forceps is basically you dip it in Savlon and you use it to transfer sterile objects from one place to another. So it does not have a lock and it has heavy blades and basically is used to pick up instruments from one tray to another. Okay, so this cheatal forceps is not used intra-operatively. It's used maybe in a dressing room to transfer sterile gauze piece or gloves or anything like that. Now, sponge forceps are basically used in the beginning of the operation for painting and draping. And this is how the sponge forceps look like. It has big jaws. The jaws are serrated, so you can use it to transfer a mop or a sponge. Now, tooth forceps are you use it, but whenever you want to have a gentle dissection or you don't want to injure tissue, then you don't use your tooth forceps. Then you use a non-tooth forceps. But tooth forceps is useful for picking up small things or to hold the skin. Basically, while suturing, when you want a good grip, you use a tooth forceps. Do not use it to handle blood vessels, otherwise you can damage the blood vessels. The plain thumb forceps is the one you use when you want to have a gentle dissection. So you want to explore, suppose a colon tissue or a blood vessel tissue or something very delicate like nerves. That time you use this plain thumb forceps, or it can also be called as a dissecting forceps. Now this adson forceps is something even more fine. So you want to have even more delicateness during handling. That is the time you use adson's forceps. So you have a small grasp, you have a small length of the forceps, and then you can use it for delicate tissues like especially hand tissues. Now this is how the AdSense forceps can look like. You use it with your thumb. You don't hold it with your palm. You hold it with your thumb and index finger. This is the way to hold it. Just like I said, artery forceps has various names. If you have a small thing, you can call it as a mosquito or a Halsted forceps. If you have a medium size, it can be called as a Spencer well forceps, and large one is called Bailey forceps. The basic function is the hemostat, the artery forceps. So you can catch all the bleeding points. And when you have a bleeder which is refusing to stop, that time you can use a cautery as well. So you don't have to touch the cautery to the vessel. You hold the vessel with the artery forceps and touch the cautery to the artery forceps. So by conduction, the cautery current can transfer through the metal and coagulate the bleeding vessel. That is how you use an artery forceps. Artery can be curved as well or even straight. You can use it to hold delicate tissues. You can use it to hold bleeding vessels and make sure that the jaws are serrated. Otherwise, you need to sharpen them. This is the correct way, like I was saying. Hold an artery forceps, thumb, ring finger, and your index finger will be at the joint. So this way you have more control over the direction and you can control the bleeding vessel. So Walker's forceps is slightly different. It is used for more of a grip. Now, suppose you want to grip some meniscus during a meniscectomy, or you want to grip some hard tissue which is not grippable. So you use this Cocker's forceps for a better grip. It can be even straight, it can be even curved. Alice tissue forceps is similar. You can use a skin, raising a skin flap, or you want to have a grip. So it's like that. But Alice forceps, as far as possible, do not use the locking mechanism when you're holding skin because it can cause skin necrosis. So be very careful. You can hold it, but don't crush the tissue. Cox forceps is used when you want to have gentleness and don't want to crush the tissue because it can be used for any visceral organ or any less traumatic thing. So, or even handling a nerve or something, but do not use force while using this Babcock forceps. This is a right angle forceps. It can be used to pass any ligature around a tendon or a nerve. And this is Lister's forceps. So let's move on to the basically orthopedic part of this lecture. And these are reduction forceps. You need to hold a bone sometimes, so you can hold these pointed reduction forceps whenever you want to have a large bone fragment. This is a special AO type of bone reduction forceps. Needle holders are quite useful. Now, needle holders, you have to identify them. They'll have serrations at the end of it. They'll have a crisscross serration and they'll have this groove to hold a needle, so that has more grip. And you can see that needle holder can be used for even removing a wire in emergency. Although the main way to hold a wire to remove it is by a plier, but needle holder is an emergency backup thing. You use it basically to hold a needle to suture things. So this is a Mayo holder. This is just the shape is different, so you have to look at the picture and then you'll find the differences. Now, towel clamp is towel clip is basically when you want to hold a secure a drape or a towel. You can also use it in orthopedic surgery to grip a piece of bone whenever you want to have a reduction of the patella, the ankle, the olecranon. But mainly the use of towel clips is to hold a drape or a towel and to ensure that they stay in place. So you can use that, and the towel clip can either be pointed or it can be slightly blunt. So the problem with pointed ones is it tears through the drapes and towels. So many a time you have to discard the drape after the use of the surgery. So you can have a blunt towel clip, but then you can use the blunt towel clip for holding bones. This is a back house towel clip. So the function is the same, just the names are different because of the shape. And now this is the BP handle or the Bard Parker handle. So you should remember that blades from 10 to 15 fit in Bard Parker handle 3 and the remaining fit in Bard Parker 4. So the small blades are used for making stab incision for fine incision, and the larger blades, the most commonly we use is 22 and 23. So those are used for making big incisions. So the commonly used things in ortho are 15 and 11 and 22. So just like this picture says, number 11 is used for making a nick, for performing draining an abscess or something. Number 15 is again for making a small biopsy, and the 22 is making for skin incision. So you should go through the pictures. You can just find it on the net, which blade looks like what shape. Okay, this is more asked in your surgery Viva. So this is the way you hold a scalpel if you want to make a smooth incision. Basically, remember that you should hold it like a pen. Next thing is the scissors. Scissors can be either blunt or sharp. I mean, I'm talking about the tip, not the blade. So you can see the blunt scissors. You can see the blade tips are blunt. Okay, so it can be either curved or straight. And you can have the Mayo or type or the Mitzenbaum. If you look at the Mayo, they are more shorter, the stout, and this Mitzenbaum are even longer. So it's basically the function. You want to dissect fine, delicate tissue, you can use the Mitzenbaum tissue, or Mayo is for more aggressive cutting. So Mayo scissors have semi-blunt ends, and the straight Mayo scissors are designed for cutting body tissues near the surface of the wound. Curved tissues are for more deeper penetration, means some angle where you can't access with a straight shape, then you may need to use a curved Mayo scissors. So basically, curved scissors are for thick tissues, like I said, aggressive cutting. And in Mbbs, you want to use a delicate tissue, so you want to just dissect a fascia and not dissect the underlying tissue. That is the time you use Mbbs. This also can be curved or straight. So the main difference, you look at this picture, Mayo is straight and it is stout, whereas Mbbs is longer and sleeker and slender. So just look at this difference and you will know the difference. Now you can have a suture cutting scissor as well. Now you can have curved suture cutting scissors, or you can have uh, these suture scissors are larger to cut the ethylon or the suture which you use to suture the skin. And bandage scissors are more robust. You can use them to cut bandages or thicker things, sometimes even the roller bandages on top of a plaster or something. So these are not the sterile ones. You use them outside in the dressing room. So just remember that. Don't confuse. Now retractors, you can either have self-retaining retractors or the non-self-retaining retractors. The most commonly used ones are the self-retaining retractors. Now, based on the shape and the size, they are named by various uh, people who made them. So even if you don't know the names of these things in the exam, you should know that this is a self-retaining retractor and the function is to retract tissues while you operate. So just I'll go through the names. The Whitelaner, Adson, Derico, Mollison, and Chanley. So now this Chanley retractor is the one which is used in hip surgery. It was designed by the father of modern orthopedics, Sir John Chanley. So you have to know a little bit more about the Chanley retractor. In your Viva, you may be asked anything about John Chanley, Hugh Owen Thomas, or Collis. So these are the scientists that you should know in common table Viva. So let's just go back to the retractor. This is the Whitelaner retractor. It has a deep prong. This is a Derico retractor. So I'm not going into detail because it's not really required for UG level. But just look at the shapes, and then this is a self-retaining retractor. Self-retaining means even if you leave it, it stays in place. So it's a useful thing that your assistant doesn't have to hold the tissues all the while. This self-retaining retractor does the work for you. Important thing I would like to stress is that whenever you use a self-retaining retractor, at least secure the retractor by a thread or tie it by a gauze piece. Otherwise, it can fall down, and then you'll have to use another one. So this is Chanley's retractor. It is used for hip surgeries. You can see the rectangular frame. So this is when you have a larger tissue, you need to use this type of retractor. So basically for hip surgeries. And these handheld retractors are the ones which your assistant will use. So it is various types: Army, Navy, Langenbeck, and Cat's Paw, Cerny. So let's just go to the details. Army Navy retractor is like both the prongs are on the same side. This is the way you retract. So it can be used for basically superficial incisions. Meerding retractor for slightly deeper tissues. You can see the blade size is little larger. The dimensions are on the screen. And Miller's hip retractor is a little longer, basically for hip, as the name suggests. Langenbeck is the one which is most commonly used. So this can be kept in your table Viva. It's quite, it can be ranging from small size to a large size. So just see the shape. This is a Langenbeck right angle skin retractor. It can be even used for retracting fascia. And this is a cat's paw retractor. Cat's paw is for even finer control when you have a small area, when you have something like a finger surgery. So you want only delicate dissection because Langenbeck is too big. Then you can use this cat's paw. But this cat's paw is sharp, so you haven't to use too much force. And Cerny retractor is again, it's another type. You can use these two prongs for minimal pressure on the skin. Nerve root retractor is for spine surgeries. So whenever you want to retract a nerve root away so that your nerve damage is less, you can use them. They have a crooked design. You can see this like a bayonet shape. This is a Caspar nerve root retractor. This is the way you retract a nerve. There are various names for it: O'Connell nerve root retractor, etc. Cobb elevator is something which you want to push tissue away from your field during a spine surgery. So this is a Cobb elevator. So you look at the shape of this cob. It is basically is a flat shaped thing, so you can push away tissues. Kerrison's rounger is something you use to remove the bone from the smaller areas of the spine. So you can have 1 millimeter, 2 millimeter, or 3 millimeter. So commonly used ones are 3 millimeter and 4 millimeter. So basically, it's like a biter. You bite away, and it is used basically. You want to remove the laminectomy, the part of the lamina when you want to approach a disc surgery. That's how the Kerrison rounger is used. It can be used as a forward biting or a backward biting, as in the shape of the rounger will be like this. Basically, you have a handle, and you, when this blades close, you can bite away tissue like bone tissue. This is the handle I was talking about. You rest your thumb over here, and you can rest your index finger over here, and just pull the trigger, and it can either bite on top or down. So it will be upward or downward. So that's the Kerrison rounger. So you just have to say rounger in your exam, and you can have a slanting blade, you can have a vertical blade, etc., etc. So you can use them in neurosurgery also and spine surgery also. This is a pituitary rounger, not commonly used in orthopedics. I'm skipping it. And this forceps are there. This forceps can be used to remove a disc tissue, or can be used even in meniscal surgery. When you want to grasp some soft tissue and remove it, and remove only that part. You don't want to damage the remaining soft tissues. So nerve hook are, you basically want to protect your delicate nerves. So this is how a nerve hook is there. It is not sharp. It has to be blunt, and it is generally at a right angle, so you can manipulate your tissues accordingly. This is the nerve hook. Now let's come to the elevators, the dissectors. This is how you dissect your tissues. So now this is a bone curette. Bone curette is used for removing some part of bone, or whenever you have a pointed bone, you want to just curette out something. When you're doing a debridement, when you want to clean tissues, so this is a bone curette. You can use a Walkman's curette. Walkman is basically you have both the sides as a curette, so you can use a small one on one side or another thing. It's mainly used in debridement. So spinal curettes are shaped slightly different. Spine surgeries. Now, osteotomes, chisel, and gouges. So most of the students get confused in the differences between what is an osteotome, what is a chisel, what is a gouge. So you have to remember that osteotome is beveled on both the edges, chisel is beveled on one edge, and gouges are curved tip. So it's like a scoop. It's like a scoop of ice cream. So this is a bone gouge. Mainly you hit all of them with a mallet or a hammer, but you have to look at the shape at the end of the instrument and then make out what it is. So osteotome is beveled on both sides, chisel is on one side. Just look at the diagram, look at the photos in the next thing. So this is an osteotome. Like you can see, it is beveled on both the sides, on this surface also and the under surface also. So basically, osteotome is used for making bone cuts, just as the name suggests. And chisel is making an initial cut. So when you want more precise bone cutting, like chisel, you imagine the sculptor uses a chisel. So you want a very precise cut. Whereas osteotome is blindly you're cutting both you're cutting the bone, and you may go to the other cortex as well. So this is a chisel, the initial precision cut, and the previous one is an osteotome. Let me just go further, and there is a bone gauge also in the picture. See, there is just like a spoon. That's for removing bone tissue, but you don't have much precision in a bone gauge. And mallet or hammer. So you won't be asked much questions about this, but at least identification. And if your Viva is going very bad, then the examiner might use it to bonk you on the head. So laminar spreader. Laminar spreader is basically you want to widen any tissue. Now you can use it during spine surgery. You want to spread the lamina open, or you want to hold the disc space open so that your access in between your disc space is more. You can remove the disc tissue, or you can use it also in a knee surgery when you want to access the meniscus. That's a laminar spreader. This is an awl. Awl is used to basically enter into a pedicle during a spine surgery, and you want to put your screws, pedicle screws in that. So that is just for spine surgery. You need to insert your screw. This is a pedicle probe, so you want to see how deep you have gone in and not damage the pedicle. So periosteal elevator can be even a freer type. It's a fine elevator, and this is a far boof type. A far boof elevator is a bigger thing. If I'm just going back to one slide, this freer elevator is a small thing. So this has a thumb rest. If you look at the cross section over here, you can see you can rest your thumb over here. So that's a far boof type of periosteal elevator. And your type of periosteal elevator is for delicate tissues when you have a small area. So that is very small size. Periosteal elevator means you're lifting the periosteum, you're not damaging the blood supply, and you can access your fracture surgeries much better without damaging the periosteum. That's why you have this instrument. So this is a bone cutter and nibbler. So see the difference between the two. Students get confused. This is a cutter to cut sharp instruments, to cut sharp bone, and the nibbler is to just blindly nibble off bones when you want to have a nibble off a larger area of bone. So you can use it during osteotomies, you can use it during amputations. Skin hook is during suturing, you can use it, or you can retract small incisions. So this is a skin hook. Now, then I'll just go to the next thing. This is a swab holding forceps. So swab holding forceps can be either curved or straight. Then you can use it for holding swabs. Towel clips. This is you can use it as a self-retaining towel clip or the one with a ratchet. So doyens or backhouse. So some things may be repeated. Just ignore them. This is again the Bart Bucker's handle. It's a repetition. Dissecting forceps. It can be plain or twisted. And again, the hemostatic forceps, like I said, the Spencer-Wells forceps. Langenbeck retractors, just look at the various stripes, Langenbeck. So this is small and large. Mayo scissors, like we said, Mayos and Mitzenbaum, you should know the difference. You can have Cocker's forceps when you want to have some grip. It can be straight or curved. Needle holder, like I've said, straight, it can be curved, it can be long, small, medium. And this is called as a Lohmann's bone holding forceps. So you can hold bone with it and you can turn this screw so that you can grip the bone. As you turn it, the distance between this prong and these two prongs reduces, so you can hold the bone. And when you want to remove it again, you unturn it. Bone holding forceps can be this type. So you can just see this is various shapes of the bone holding. So whatever comes in your exam, you at least you know what the function is. Bone hammer need not say anything. Chisel already discussed. Bone gauge, this is another bone gauge. You just take a scoop and take a scoop of bone out. And osteotome. Bone nibbler, it can be straight, curved, or it can be fine also. Just whatever the shape is, just try and identify it. And it's generally self-retaining. So bone cutter is like this. Periosteal elevator, this is the Forboof type where you can rest your thumb over here so that you can have fine control. Bone scoop is similar. Now plate bender. So now look at the diagram. You can see this plate being bent. Okay, it has 3 points. Once you have 3 points, you can bend a plate as per your wish. So don't get confused by seeing this instrument. This is a hand drill. So when you have a power failure or a instrument failure, so this is a backup instrument. You can use it for drilling bone or putting a wire, anything. So this has a chuck with a key. So you can use it as a drill holder. Okay. This is a very important instrument. It's not an instrument, actually, it's an implant. It is a stainless steel wire. It can be either 18 gauge, 20 gauge, and if you want a thick one, it can be even 16 gauge. Here, the gauge is the diameter, and the smaller the diameter, the larger the size. So 16 will be a thicker one, whereas 20 and 22 will be fine wire, which can be used in dental surgery. So just you'll be asked the uses of the stainless steel wire. So it can be used in encirclage system, and you can use it as a tension band principle. So the tension band principle can be used at olecranon, patella, and medial malleolus. So just go back and read what this tension band principle is. That's commonly asked question in the table I got. Bone saw is used for cutting the bone for amputation. And you can use, now these three things are very commonly confused. So what is a K wire or a Shan's pin or a Steinman pin? So K wire, you should know that it stands for Kirschner, Kirschner, Kirschner wire. Okay, so this is not to be confused with the K nail, which is Kirschner nail. So Kirschner wire and Kirschner nail. This is the stainless steel wire which is sharp at both ends. It is smooth, whereas Shan's pin is serrated at one side, and Steinman pin is thicker, but it is not serrated. It has a triangular cross section. So K wire is used commonly for fixing various fractures. It can be used for fixing small fragment, provisional fixation before putting a plate, etc. A Shan's pin is basically used for external fixation, and a Steinman pin can be used for traction or even fixing a larger fracture. But most of the time, K wire is left in the body, whereas a shank pin is half outside the body, half in the body. And Steinman pin can be used for traction. That is a temporary thing. So just note the difference. Once you see it in real life, you won't make a mistake. But don't confuse the names. You'll have to mug up these names: K wire, shank pin, and Steinman pin. So hip prosthesis is one of the most favorite part of students, and you can use it for fracture neck femur when you want to replace the part of the head. So you can use an Austin Moore prosthesis and or Thompson's prosthesis. So Austin Moore prosthesis has fenestration. One reason of the fenestration is you want to have bone growth in between this hole so that you get a secure fixation of the implant. And second thing is you want to have good removal. So now this hole is different. This hole is used for easy insertion or removal of the implant, whereas this hole is used for bone growth so that the implant incorporates in the femur better. DHS is a sliding implant. It is a dynamic hip screw. So this consists of the plate, screw, and a barrel. So as the patient bears weight, it is a sliding implant. The screw heads towards the, so it compresses the fracture. So it is used in intertrochanteric fracture of the neck femur. Dynamic condylar screw can be used in various fractures. It can be used in the lower end of the femur fracture, it can be used in proximal end of femur fracture. So this is a 95-degree angle. So this angle is always 95 degrees. It's a dynamic condylar screw. Like the name suggests, is used for the femur condyles. An interlock nail and a K nail. K nail you should see that it is used for femur fracture fixation. K is the Kirschner in this case. Okay, so this is a Kirschner nail, and interlock nail, it has holes for interlocking. So interlocking gives you rotational stability. You put two bolts across these holes, so you get rotational stability. So that is the difference between the interlocking nail and the K nail. Various types of plates are available. You can have the semi-tubular plate, you can have the dynamic compression plate, you can have the locking plate, or the low contact dynamic compression plate. So these are the various types. Mainly low contact means you are having a ridge under the plate. So along with the, I mean, you don't have that much pressure onto the periosteum and you don't damage the underlying structure so much. That's why it's a low contact DCP. Whereas a locking plate means it has threads over here, so your screw can lock into the plate. And this acts like an internal external fixator, which means that the screw joins with the plate, so you don't have that much you have more stability and a better construct. Okay, and semi-tubular plate is like the name says, it's just a semi-tubule. The cross section is just one half of a circle. So this is the back side of the same plates. Okay, so now this will be the low contact plate, whereas the ridges are there on the undersurface. Various screws are there. You can have a cortical screw, cancellous screw, or the malleolar screw. So I'll just come to that in a few slides. See, Steinman pin, the main thing is it has no threads. So it can be used for compression arthrodesis or skeletal traction. Ham pin has threads in the middle. So to identify it by the threads, and it can be used in osteoporotic bone. Chance pin has a thread at the ends. It is used in external fixator. This rod is Harrington's rod. It was used in spine surgeries in the past. Nowadays, pedicular screws have replaced it. But just that you should know for identification. So for spine surgeries, for scoliosis surgeries, this rod is used for spine fixation, not in the femur or anything. And rush nail is a nail which can be used for small bones or humerus, fibula. So you have a hook for extraction of the nail, and one side is beveled up. So you can have intramedullary nail for forearm bones, which can be used in pediatric. Nowadays we use the TENS nail, which is titanium elastic nailing system, but you can still use these. You can use an ulnar nail, which has a square diameter, and a radius nail, which has a well at the tip. You can identify this thing. Just go back and see the pictures. And the radius nail looks like this, which has a bevel at the end. Ulnar does not have a bevel. Now, this is the nail I was talking about. It has a clover leaf cross section. So you can see the picture, clover leaf shape. That is why this, and this slot is there for removal. And this is how it is, because the clover leaf shape reduces the weight with this cross section. That was the K nail, but the problem with the K nail, it does not have any rotational stability. So that is why you have to have an interlocking nail nowadays. So you have a rotational stability. This was used in the past. It has a 3-point fixation as the principle, and it can be used in a young patient as well. It can be used in a transverse or a short oblique fracture. Now, a nail can be either put from retrograde fashion or a closed fashion. So let's skip that much. Yeah, this is the interlocking nail. Like I said, you have interlocking bolts, so you have a rotational stability. So look at the picture and see how the rotational stability is achieved compared to the previous K nail, which did not have these bolts. The V nail is used for a tibia. This bend is called as a Herzog's bend, which has 11 degrees angle. So it's for easy insertion. So whenever you see this angle, you know that it is for the tibia. It is not for the femur. This 11-degree bend is for the insertion into the tibia. So it can be either a V nail, which is like a V cross section, or it can be used, even there can be a tibia interlocking nail. So that also is the same, like the femur. This is the V nail. And Moore's pin was used for fracture neck fixation in the children. Uh, not going to be asked in your table however at all. This is a screw. Screw parts you'll be asked. What is the head? Is the shaft, and then this is the threads. So pitch is the distance between the two threads, and there are two screws: cortical screw and a cancellous screw. So cortical screw has more threads, but the pitch is less, and the cancellous screw, the pitch is more. That means the distance between the two threads is more. So cancellous is used for soft bones when you want to have a better grip. Therefore, you have more distance between the threads. Cortical used for harder bones. Now, screws can be either fully threaded or partially threaded. It can be mostly 3.5 size or 4.5 size, whereas the cancellous can be 4 mm size or 6.5 mm size. So the uses are shown on the screen. And now this prosthesis, the Austin Moore prosthesis, I've already told you the uses of the holes. This eye hole can be used for removal as well, or during insertion to control the version. So you can use it for neck femur fracture. The Thompson's prosthesis does not have these holes. So the way to identify between these two is the holes. And you can use them with or without cement. The bipolar prosthesis is an advantage over them. Bipolar means you're having two planes of motion. One is between the acetabulum and the cup, and one is the cup and the head. So there are two extra planes of motion, so you reduce the wear and tear. This is the bipolar prosthesis. And same indications, fracture neck femur. So this is a cross section of the chisel. Chisel is one side bevel, whereas osteotome has two sides bevel. So chisel is used to chip the bone, osteotome is used to cut the bone. This is a chisel versus osteotome. Look at the pictures, chisel versus osteotome. Periosteum elevator, Farbos, and this is along with that. So don't confuse chisel, osteotome, and periosteal elevator. This bowler stirrup is used for traction, skeletal traction, along with the Steinman pin which passes through the bone. You can use a stirrup which is outside the bone, and you put a weight on this. So it's basically used for traction. Thomas splint is not an implant, it is actually just a splint. So you can just don't confuse it. You can have either a Kramer wire splint, which can be aluminum type, or a Thomas splint. The Thomas splint has a hip ring and outer longer rod, inner shorter rod, which you use traction, and you can put bandages on the under surface and give traction. You can either give a fixed traction or a sliding traction. So Thomas splint, basically, you should know everything about Hugh Owen Thomas, who's the father of orthopedics, and he used this splint for immobilization of the knee in tuberculosis. You should know these parts of the Thomas splint: ring, medial bar, and lateral bar. And this is a bowler blonde splint for use for either action in the wards. This has 4 pulleys, sometimes 3. So you should know the function of the pulley. This pulley is used for calcaneum traction. This pulley is used for the femur traction, and this pulley is used for preventing foot drop. So sometimes you can have only 1 pulley, sometimes you can have 3 pulleys. So just like I said, pulley A is for calcaneum traction, pulley B is for femoral or proximal tibial traction, and pulley C is to change the angle of traction. So like to prevent a foot drop. See the picture, you'll get your concepts clear. And this is an external fixator clamp used for external fixation in a Steinman pin. K-wire is, like I said, stainless steel wire. It can be used for fixation of any bone. Basically, it is pointed at both the ends. And here for small fragment fixation, you can use it for JES or CTV. JES is Joshi's external stabilizing system. This is a stapler. You can use it for growth arrest in genu valgum, genu varum, or in arthrodesis. Bone nibbler is for again smoothing the cut end to remove any extra growth like an osteochondroma, and you want to remove soft tissues. This is the JES system, Joshi's external stabilization system. You can use it for external fixation or the CTV. Chanley's compression device is, you can use it for arthrodesis. Arthrodesis is destroying the function of a joint. And this is for intertrochanteric fractures with SP nail. So it was used, nowadays it's not used so much. Nowadays the DHS is used or the TFN is used. This is a Jewett nail plate for trochanteric fixation. McLaughlin's plate. These are all historic implants, so I won't go into detail of that. This is how the Smith-Peterson nail was used. And the dynamic hip screw. So I don't have the photo of this trochanteric femur nail or the proximal femur nail. But just go on the net and look up PFN or TFN. So you'll get more knowledge about that. This is a dynamic compression plate, because the reason it is called dynamic is like while you're putting the initial screw and you're putting the second screw, there's a compression as you tighten the second screw. So that is why dynamic compression, because you're moving the plate while the fracture is opposing. So that is the reason. Dynamic condylar plate, like I said, the angle is 95. This is a Sherman plate of, you can have a small diameter, small thickness. And last thing is the 1/3 tubular plate. This is a thin and moldable. You can use it on the fibula or the distal ulna or the lower tibia. So wherever you have a small bone and you want to mold your plate. So thank you. I'll end my slide right now.